Might as well kick things off. Appreciate y'all for being here today. We have a very important bill package that we introduced yesterday in the House and the Senate. I'm joined by Senator Albert and then Jamie Reed, who's here today. I'm really grateful for anyone who's taken the time to apply their mind to this very important issue. This bill package that we have introduced seeks to uphold the gold standard for the most vulnerable among us. And these are young people in the state of Michigan who are questioning their very identity, something that is immutable within them, their sex, their biological sex. This bill package has been shaped by many minds. We want to have something that is comprehensive, that cares about young people that are in these vulnerable situations, but applies to the physicians that are maiming children in the name of care. The HHS just came out with a report that described that what is happening here in the state of Michigan at many of our hospitals, puberty-blocking drugs, surgeries, chemical castration, a lot of very invasive procedures that are being performed in the name of care on the most vulnerable young people among us, are not backed by long-term evidence. And so other countries, England, Cass Review, have established that procedures and experiments that are happening on children are not founded in long-term evidence. And so this legislation seeks to uphold medical policy of do no harm, and then also to, again, provide the gold standard of long-term evidence-based procedures for the most vulnerable among us. Senator Albert is here to break down exactly what the bills do and to give a couple comments as well.
Thank you, Representative. The state has an obligation to protect kids. That is why we have common sense age restrictions on a wide range of activities, from driving to smoking to drinking. These safeguards exist because we understand that kids need time to grow, mature, and fully understand the consequences of major decisions. These bills follow that same principle. This legislation would only apply to patients under age 18. These bills would prohibit procedures designed to alter the appearance or align with a perception of sex that is inconsistent with the minor's birth sex. That would include puberty blockers, certain hormone treatments in abnormal amounts, sterilization, removing healthy body tissues or body parts, and surgeries to artificially construct tissues inconsistent with the minor's birth sex. Medical providers who violate this legislation could see their medical license. They could see sanctions up to losing their medical license. We must approach this sensitive topic with compassion, care, and common sense. There are thoughtful exemptions for children diagnosed with sexual development disorders by a physician in cases where treatment is medically necessary. This legislation does not criminalize procedures. What it does do is allow those who have been harmed by these procedures as minors an opportunity to seek relief. These bills also require insurance companies to cover the costs for individuals who choose to detransition. As a parent of both sons and daughters, I understand the importance of coming to this issue with compassion. I want any kid that is going through a difficult time to get the support that they need. That care should be evidence-based and always in the child's best interest, both now and in the future. We are fortunate to have a guest here today with us today. We have Prisha Mosley was not able to get here because of some car trouble, but she will be available later today if anybody would like to talk to her. But next up, we have Jamie Reed, who previously worked at a transgender center of a children's hospital and now shares concerns related to that industry. So, Ms. Reed.
Good morning. My name is Jamie Reed, and I hold a Master's of Science in Clinical Research Management. I am a lifelong Democrat, a mom of 5 boys, and a lesbian. I am also the public whistleblower from a pediatric gender center. I worked with patients who ranged from the age of 3 until the age of 26, and I've worked with nearly 1,500 unique patients. I worked in pediatric gender medicine for nearly 5 years and was once a true believer. I am here today representing a national organization called the LGBT Courage Coalition, an organization of gays and lesbians, and we support this bill. And we support Senator Albert and Representative Paquette for leading the way in Michigan for the health and safety of children. Medically transitioning children started in the Netherlands, and they created this 3-part protocol puberty blockers, cross-sex hormones, and then surgery. They started this with 70 children. Puberty blockers are gonadotropin-releasing hormone agonists. Lupron, which is commonly used and is being used in Michigan in children, was never approved by the FDA for this and is being used completely off-label. No animal studies were considered before this protocol was undertaken. After we started giving this to children, then a study in sheep found a reduction in long-term memory. This means that GnRH agonists will irreversibly alter the cognitive function during a critical window of development in children. The first child that this was done on, so-called patient X, was a young lesbian. In fact, 68 of 70 of the first young people were same-sex attracted. As a lesbian, this concerns me because most of us experience profound questioning of our sex bodies in childhood and adolescence. In that first study, a young person died. They died because the puberty blockade meant that their penis never developed. They were never able to have a vaginoplasty, the surgery that used to be done to invert the penis, and so they had to have a portion of their colon used. This led to a massive infection, and that young person died. It is critical that legislative bodies step in to protect children in this state from these dangerous and reckless practices. I was complicit in harming patients because the protocol itself harms patients. There is no safe or legal way to sterilize a child, and there is no safe way to medically disrupt a functioning endocrine system. I will forever know that I participated in one of the gravest medical scandals in our time. I am sorry for the harms that I caused, but Michigan does not need to continue down this pathway. I support this legislation as a lifelong Democrat. I know this protocol as a medical expert, and I rely on these excellent representatives who have done their homework to put forth this medically evidence-based bill, which we fully support. I welcome any of your questions.
And with that, can definitely field any questions. One thing I do want to note is that none of you have to be here today. I'm very grateful that you are, because this is an issue that needs to be questioned. This is an issue that needs to be discussed with depth. This legislation has the minds of evolutionary biologists, doctors, scientists, detransitioners, other legislators from other states in on it. So we wanted to craft this with an even hand. And so you guys being here, very grateful. But yes, we're here to take any questions, any and all questions from you all.
Democrats currently control the Senate, even though this is not receiving any traction.
So I had some Democrats actually coming around when I was doing my co-sponsorships in the House, and they were asking about it because I know for a fact that they have detransitioners in their community. And this is an issue, the dam is breaking on it, where people are starting to look at the pseudoscience and the experimentation that's happening on children. So we're intending to inquire, cast a wide net of our Democrat colleagues in the Senate. But Democrats are aware of this, and they were all invited to this. They were all invited to meet with Prisha Mosley, our detransitioner from Big Rapids, and Jamie today. We're hoping that they'll inquire and learn about this, because the more you learn about what's actually happening, just like Senator Albert and I have been talking about this for a while now, and he did not run on this issue, nor did I. But when you realize that this is going on and you start learning about it, it draws you in just for the sake of what's happening to children. And so I just beg my Senate colleagues on the Democrat side to be involved and to learn about this, because when they do, they'll be hooked and they'll realize that this is a worthy cause. Any other questions? Don't be shy.
Kid.
I guess, to ask another question, what would your message be to folks who have transitioned without medical complication and are, say that we hear from transgender folks sometimes saying that the transition prevented them from otherwise committing suicide?
Yeah. I'll let Jamie answer. What I would mention is this focuses on minors, and children cannot consent to maiming their healthy body for life in the name of care, or in the name also of achieving something that cannot be achieved, and that's changing one's sex. That can't be done with drugs and surgery. And so misleading a child to believe that they can change their sex and they can't is wrong. And when you maim yourself in your healthy body, right, your sex, to become something you cannot, are you in the middle ground? What do you become then when you ruin your official body for cosmetic surgery and cosmetic appearances? Children cannot consent to that, but I'll let Jamie build on that as well.
Thank you for that question. There is no doubt that there are individuals who have medically transitioned who will individually report that they believe it was the best thing for them. What that does not mean is that we have an evidence base to show that it is a practice that should be being offered to children. Evidence-based practice requires that we have enough medical evidence to show that for most patients, the benefits will outweigh the risk profile and the harms. The profound risks that we know of with this is that for any boy who goes through this from the beginning, puberty blockers, cross-sex hormones to surgery, we know that they will be forever sterilized. That is not something that children have the ability to assent to or their parents to consent to. We also know long-term that most of those young boys will also experience profound sexual dysfunction for the rest of their lives. That's also not something that we can remove from a child without their consent and assent in childhood. Trans people who have medically transitioned and feel happy in that decision should have only been offered that decision as an adult and also only with proper evidence-based medical care. Just because we can do something and a few people say that it worked for them does not mean it should be the medical policy of the state moving forward.
Can we also discuss the part of the physician side of it and those consequences, or at least that part in this bill as well?
The physician side, yes. So this does focus on physicians because no physician has a right to name a child. And so this focuses on prohibiting it through their licenses being removed if they are to perform any of these very invasive procedures.
And what does that process look like? Did you have that in this?
Yes, we did. And it's a restriction of a license, and the detransitioner or the child that's maimed hasn't published until 20 years afterward to go after the individual's license. But did you want to build on that with physicians in mind?
Yeah, if you want to.
Or did you have follow-up questions?
Oh, no, thank you.
Okay, all right. Okay. Well, thank you for attending. And again, Prisha Mosley will be driving in. She's driving in from Big Rapids, and she will be here as well to share her testimony as to how she was harmed in the name of care. And it's very compelling. She'll be with me on the House floor as well as a special guest with Jamie, too. So thank you again for being here. That concludes the conference.